Hi, everyone. Thank you so much, Lauren, and thank you for coming to today's lecture. I'm very excited to hear about this very exciting topic that's not common, I think, and I'm sure Dr. Murphy is going to do an excellent job addressing it. Dr. Murphy is originally from New Jersey. He attended Williams College, where he received his undergraduate degree in psychology. Following this, he went to worked at Walter Reed National Military Medical Center. He got his MD from Tufts University, then finished his residency at Barnes Jewish Hospital, then came to Yale for his pulmonary and critical care fellowship. And then we were very fortunate enough to retain him to our Yale Sleep Fellowship, where he is wrapping up his very productive year and moving forward in his career as a pulmonary critical care and sleep medicine attending. So today's going to talk about lucid dreaming. Very excited for that. Thank you, Ian.
All righty. Thanks so much. Well, welcome everyone. I want to start with a couple of just existential questions to kind of prime your minds. Have you ever wanted to fly? Relive the best parts of your life? Or battle against your nightmares? Well, I'm here to argue that it could all be possible with lucid dreaming. So a little roadmap for today. We're going to talk about the definition of lucid dreaming. We're going to talk about the history. We're going to give some patient perspectives, a little bit of the research that's gone on in the field. I'm going to offer some ideas on how to actually lucid dream. Then we'll talk about the very exciting idea of dream engineering. And finally, I'll offer a few concluding thoughts. So defining lucid dreaming. So lucid dreaming is a state where you become aware that you are dreaming and potentially have the ability to influence the content of the dream. Common themes of lucid dreamers include flying through the air like a superhero, or spending time with loved ones, or even traveling the world. The important distinction here is that lucid dreaming is distinct from vivid dreams, because in that case, the dreamer does not actually have control over content. It turns out that lucid dreaming is actually somewhat common. So at least half of all adults say that they've had at least one lucid dream in their lifetime. And 23% of people who consider themselves regular lucid dreamers have a lucid dream at least once per month. Let's talk a little bit about history. So we've been fascinated by dreams for thousands of years, going as far back in Egypt in the 3000s, Greece, and most recently, Inception, which incidentally was written and directed by Christopher Nolan, who in an interview said that he was inspired by his own lucid dream, and that's what led to him writing the movie Inception. So what has changed in the past 5,000 years? I mean, essentially, we know that lucid dreaming, or the idea, has been present for millennia. We remain really fascinated by our dreams. And maybe we finally have a little bit of a structure to describe what it is we're seeing and dreaming about. And maybe with that in place, we can give context to the meaning of our dreams. I want to offer some patient perspectives here. So here's a 62-year-old gentleman, has a history of PTSD, hypertension, and you're seeing him in the VA clinic. He's trialed multiple medications without benefit, and he's curious about non-pharmacologic options. In the interim, since you see him, he comes back and says, you know what, I actually taught myself to lucid dream, and I've had these instances where I can take control of my nightmares. And after doing that, I feel like I have better symptoms. I have better sleep latency and total sleep time. And honestly, I'm sleeping great. Another patient you see says, well, it's a 24-year-old woman who has a history of hypersomnolence and sleep attacks, but she loves lucid dreaming. She knows that when she goes to sleep, she goes right into a dream. And so she's taught herself to lucid dream because she's aware of the ability to control her dreams. And she doesn't mind fatigue at all because she has great dreams. Now, you do an MSLT and you do, in fact, confirm the suspected diagnosis of narcolepsy, but the patient is honestly a little bit anxious about using any medications that might suppress REM because she loves having lucid dreams so much. Here's an artist depiction. By the way, Googling or AI looking at lucid dreaming really comes up with some fun images. So I do recommend that. So let's talk a little bit about research on lucid dreaming. So obviously the question is, how do you build a framework for studying lucid dreams where a patient says, I've woken up in a dream? Right. The question is always, how do you know when someone is lucid dreaming? And I really like this somewhat elegant solution where a lucid dreamer and a researcher come up with this predefined sequence of eye movements that they can replicate in the dream. So the idea is when you're awake, you do a couple of eye movements. Maybe it's back and forth 3 times, looking left, right, left, right, left, right in quick succession. And then if you enter a lucid dream and you wake up in your dream, you remember to do that same pattern to show someone reading your PSG that you are, in fact, lucid dreaming. So the idea is that you could potentially objectively measure the presence of lucid dreaming via these distinctive eye movements, and they've termed that signal verified lucid dreams. So here's an idea of what that looks like. So here's a PSG during wake, looking at the EOG specifically. And here it is again during sleep. Again, these aren't perfect, but you can see that there's this rapid succession of eye movements that look similar between wake and sleep. The idea being this subject has woken up in their dream. They've remembered that they're going to do this look back period, and they're going to tell their researcher that they are, in fact, lucid dreaming. So the question evolves into, well, okay, if lucid dreaming is real and we can measure it to some degree, when does it occur in sleep? So obviously, again, it's a newer field. So there's a small study in Germany where they looked at signal verified lucid dreams and they used a larger montage. And they described some differences in EEG specifically during lucid dreaming. And they identified this high frequency at about 40 hertz in the frontotemporal region. And that seemed distinct compared to REM. So you can see here, wake at the very top, where you see a lot of activity. Lucid dreaming, you can see this little sort of increased Hertz activity in the frontotemporal region, and then REM looks different. So this group argued that lucid dreaming is actually a hybrid state between wake and REM. Now, of course, when any good study comes out, you have someone who directly tries to challenge that. So this is a study now done in the US, and their intention was to address this question of, is lucid dreaming a hybrid state? And again, a similar number of volunteers, and they instead argued that this increase in this 40 hertz signal is maybe just attributed to spike potential artifacts because of increased REM density. So again, here is their initial study where they're looking at this 40 hertz spike in the frontotemporal region. And here's them in their world cleaning out some of the noise. And so you see this more normal distribution. And so they conclude that while lucid dreaming is associated with a high, but maybe not unusual degree of EEG activation during REM sleep. So one group says it's a hybrid, and one group says, well, maybe we just have very, very high potential of EEG activation during REM. Important to note that, like our patient we described, there is a lot of overlap between narcolepsy and lucid dreaming. Now, there was a study done where they looked at people who had narcolepsy and they asked, do you have lucid dreams? And it turns out that at least 75% of people who have narcolepsy have had at least one lucid dream. And I'm most interested in the last column, which describes the number of lucid dreams per month. And you can see patients with narcolepsy on average have 7 lucid dreams per month compared to the control group all the way on the right, which are averaging less than 1 per month. And so in general, they estimated that more than 50% of patients with narcolepsy were regular lucid dreamers. So I think it's important to keep in mind, especially as we're counseling patients either about lucid dreaming or about what we can do for them to take control of their dreams and why that might be helpful. So one example is that we wonder whether lucid dreaming could help with hypnagogic hallucinations. And obviously, in some cases, having these REM intrusion symptoms can be very distressing. But it turns out that people who are lucid dreamers maybe become very adept at realizing, hey, I'm in a dream, I'm awake. And so they can distinguish between those two things and maybe parse out what it means to be in a dream or what it means to have this REM intrusion. And so there's this argument that this study puts forward that says we should be using these metacognitive strategies like seeking evidence of being awake, using a reality check to see, oh, am I dreaming? Is this real? Or, interestingly, if we're starting to have those hallucinations and they're distressing, try to take control of them and use them to push yourself right into dream state. Again, these are complex sort of metacognitive theories, but the idea being that maybe you can empower someone who has narcolepsy and enters dreams rapidly or has hallucinations. You can empower them to take those symptoms and use them to their benefit. There are lots of benefits of lucid dreaming in general. So these are four smaller studies. In one study, they found that compared to non-lucid dreamers, people who lucid dream regularly felt happier, had more positive emotion. In some groups, they found that it encouraged creative thinking and even problem solving. Again, some groups found that it decreased levels of depression and anxiety. And then as we get to even more specific treatments, looking at people who had PTSD and recurrent nightmares, the process of learning to lucid dream actually improved those symptoms. And I want to present one of those studies for y'all. So this is using lucid dreaming as an adjunct to normal therapy. So they took 32 subjects who had both PTSD and nightmares. In the dark boxes, dark columns are people who were just given standard therapy, and the lighter gray boxes are those that were taught to lucid dream. And so if we're looking at their total PSQI score on the far left, a lower score indicates less severe symptoms. And so in general, right, all groups seem to have improvement over time. But interestingly, this lucid dreaming group had a shorter latency to improvement in that middle column, and they seem to have sustained benefit in that final column. So there seems to be something that is inherently improved in terms of PTSD symptoms if we empower those people to learn how to lucid dream. Of course, lucid dreaming is not perfect. There is concern that the active nature of lucid dreaming can lead to sleep fragmentation. We'll talk a little bit about some ways that people learn to lucid dream, and some of them almost intentionally fragment sleep. There is a risk for lucid dreaming where those people who have an underlying psychotic disease, where they might have more derealization, where they're unsure whether they're dreaming or awake. And then there's also concern that dreams could be augmented negatively, that you might not be able to actually control your dreams, but have much more vivid dreams that could be more intense and distressing. So just want to summarize some of the things we chatted about, just that lucid dreams may be able to be identified on PSG, unsure whether this is a hybrid state or whether it's really unique REM. There's definitely a strong correlation between narcolepsy and lucid dreaming. There are potential benefits via small studies, things like mental health, creative problem solving, and maybe even treatment of PTSD. And the caveat here is there are certainly risks, things we need to consider like fragmented sleep, derealization, and augmentation of nightmares. So now to the fun stuff. I want to give everyone at least a brief tutorial on how to lucid dream. So Dr. LaBerge on the far right is one of the pioneers of lucid dreaming, and is actually his study, which was the beginning slide about how do we do signal verified lucid dreaming. But it turns out there are tons of books on how to figure out how to train yourself to lucid dream. So here's a couple of methods that are a little bit more common lately. So this is the dream initiated lucid dream. This is probably, if you've ever lucid dreamed, this is the one that you may have experienced. And this is essentially where you're in a dream, something's happening, and suddenly your mind says, oh, am I dreaming? Is this normal? Is something strange happening here? And then you realize that you're dreaming, and you're able to maybe control the content of that dream. A lot of people who ascribe to this method recommend using a dream journal so that you can be more precise in what is a dream and what is not a dream, and that can help you become aware of when you're lucid while dreaming. A more complicated strategy is a wake-initiated lucid dream, and this is quite literally where you're trying to move yourself from a waking state directly into a dream. And again, reportedly, in some cases, people who become so good at this essentially can push themselves into REM and cause sleep paralysis in that process because they become so effective at putting their mind into this dream state. A more interesting idea that's starting to enter sort of the human consciousness right now is using external stimuli to trick your brain to wake up in a dream. And so this can be something where maybe you're sleeping and you're wearing a headband that gives a flash of light or a smell or gently vibrates, and that maybe activates your brain just enough so that you don't wake totally, but while you're dreaming, you suddenly realize that there is reality and there is dream, and you can be awake within your dream. Finally, and a rather interesting strategy is the wake back to bed strategy. And the idea here is that you set an alarm after about 6 hours of sleep with the intention of knowing that the longest REM periods are occurring at the end of sleep. So you wake yourself up, you try to prepare yourself to have a dream with the intention of waking up in that dream, and then you go back to sleep. Obviously, again, a lot of these might fragment sleep, particularly the last one, where you're intentionally setting an alarm to wake up, fragment your sleep with the intention of trying to lucid dream. There was a really nice review article that came out that evaluated all of these different methods. And so they looked at whether you're trying to do dream induced, wake induced, you're using some of these external stimuli, even in some cases, external stimuli where they were using EEG to try to stimulate brain waves that might mimic REM or push the body towards REM. They even tried some medication options, and they looked at these 14 different techniques, and really two stood out. So the most effective was the mnemonic induction of lucid dreams. We'll talk a little bit more about that in a second. The other turned out to be using galantamine. And this is a small study, but galantamine is an acetylcholinesterase inhibitor. And there was definitely a positive correlation with taking the drug and having more common or more frequent lucid dreaming. All of the other techniques were deemed either ineffective or ambiguous. Given that it's the most well-researched, most well-researched technique for causing lucid dreams, I thought it would be fun to just talk through what the mnemonic induction of lucid dreams really means. So it's 4 essential steps, and they seem simple, but I'm just going to take time to talk through them. So the first step is to set up dream recall. And that means before going to bed, you resolve to wake up and recall dreams. So you intentionally set yourself up to say, if I wake up from a dream, I'm going to recall that dream and be intentional about recalling that dream. The second step is to directly recall your dream. So the idea is you're in REM, you're having a dream, you incidentally wake up, and if that happens, you take the time to write down and recall your dream. You don't immediately try to put yourself back to sleep. You instead expend some energy trying to recall your dream and as many details as possible. So the example I'll give here is that let's say you were dreaming you were on a beach and you were dreaming you were on the sand. You need to recall all of those details. Where were you? What did it look like? Was there a shark that was talking to you? Were you swimming? Were you walking? Were there people with you? I'm trying to recall all of those details as much as possible. Then you start to focus. And so you focus on the intent of, I'm going to go back to sleep, but the next time I'm dreaming, I'm going to recognize that I'm dreaming. And you pair that with the fourth step, which is seeing yourself becoming lucid. The idea being you've spent a lot of time thinking about, I'm on this beach, I'm in the water, I'm swimming, and when I go back into the dream, I'm going to notice that this is not real, that I am in a dream. These are the things I've noticed that are consistent with dreaming, that are different from being awake. And I'm going to notice that difference in the dream, and that's going to let me take control of the dream. They phrase it as rewriting your dream to notice you are dreaming. Now, there are a couple of caveats that I will add. One is that in the best cases, there's the recommendation to stay up in step 3, where you're focusing on recalling your dream, where you're intentional about identifying all the differences between your dream and wake state. And it's suggested to take about 10 or 20 minutes to do that. The other thing is that people recommend doing prospective memory training. And what that means is that the idea is you spend your daily life answering the question, is this real or is this dream? And by that, I mean, if you experience something unique in your life, like you hear a dog barking, you try to think about intentionally, what are the emotions I feel? What am I seeing? What am I noticing in myself? And using that, you can ask, okay, the next time if I see a dog in a dream, am I feeling the same things? Or is this a dream? Is this different? How do I know if I'm in dream or if I'm in wake? Now we get to the fun part. So people have taken this to the next level and not only tried to teach people how to lucid dream using some of these techniques, they've gone to the next step and said, well, we're just going to start engineering dreams directly. We're going to take that inception idea and make it a reality. So dream engineering, the idea is that sleep researchers and engineers have started coming together with technology to induce lucid dreaming. Right now, the most effective strategies typically are using a combination of both EEG data and some sort of sensory cues. And you can imagine the applications that they cite are pretty endless. Everything from adjunctive therapy, as we've talked about, to just stimulating creativity or allowing someone to enjoy life. Here's kind of a schema of what they're proposing. Essentially, you have a person who has an EEG headband in place that's connected to some other sensors. And when that EEG detects REM, it uses either a light cue or a sound cue or a smell cue meant to wake the dreamer up within the dream, but not fully wake them up. With the idea being that if you're able to wake the dreamer up within the dream, they can take control, particularly with practice, and they can become a lucid dreamer. So again, there is a lot of public interest in this space. This is from a Kickstarter where a group of people created a device that they termed the Lucid Dreamer. And uh, it they had significant backing. So they made more than their goal. They almost, had $150,000 pledged. Unfortunately, funding for the project was canceled. And I thought this was really interesting that the group said that, actually, we cannot guarantee that this is going to induce lucid dreams. And so they refunded everyone's money, which, if I'm honest, when I'm thinking about these sort of tech companies coming up with these really weird and unique ideas, I think it's really admirable, actually, that they said, we're not sure this completely works. We're going to refund everyone from now and then keep fine tuning. And the last I checked on this Kickstarter, they're actually recruiting people to test out their new model with the hopes of having more success with their lucid dreaming device. So here is Dormio. That's another dream engineering device. Certainly a familiar, maybe shape. It seems like they may have stolen this from the WatchPad technology. But Dormio was invented at MIT, and the goal with Dormio is targeted dream incubation. So again, they're using this watchpad or glove-like device, and they're using auditory cues. So what they do is the glove, like the watchpad, is detecting muscle flexion, heart rate, electrodermal activity to identify sleep. And once the person is in sleep, the idea being potentially like absence of movement, maybe towards a REM sleep, there's an auditory cue connected to a separate device that gives the user some dream incubation idea. So they're trying to incubate some idea without waking the user. And then in their initial study, they woke the user at predetermined intervals and asked them to describe their dreams. So they're giving you some sort of cue that ideally you're not fully awake for. Then they're waking you up after an hour and saying, what did you dream about? So was it effective, this cueing mechanism? Did that actually push you to dream about something specific? So their first study was completed a little while ago, and they looked at 50 participants, and they started with a simple idea, and the idea was tree. So you're dreaming, you have this device on your hand. It's ideally starting to sense when you're nearing REM, and then it's giving this auditory cue, tree, tree, tree. They're letting you sleep more, waking you up, and they're asking, what did you dream about? So there were lots of direct reports of patients who referenced tree. Obviously, you can see that people who slept without incubation had no mentions of tree, which I suppose is a good control. And I really like some of the narrative responses to what people dreamed about or said that they dreamed about when they were incubated with the idea of tree. So one person said, I think it's really, really useful for creativity. At the beginning of my dreaming experience, I was seeing scenes that were the same size and functionality of real trees. But then the second time, I was much bigger than the trees, and I could eat them all like finger food. Another person said, my dream was pleasant and mysterious. I never knew what the next part of my dream was going to be. My dream did involve a tree. I was following the roots with someone, and the roots were transporting me to different locations. So they argued that they were able to incubate this idea of tree in people, and that was distinct from other normal sleepers. They argue that maybe they could continue to expand this idea and incubate more complex ideas, allow the user to lucid dream and explore that creative space more. Now, another group took dream engineering as separate from incubating dreams and thought about it more as therapy. So this is a research team at Stanford who just published their data in the past year. And it was born out of this interesting phenomenon that anesthesiologist noticed. So he noticed that who had an underlying history of depression or particularly PTSD, when they awoke from specifically propofol-induced anesthesia, they said that they felt better. They said that they felt they had good dreams with propofol and they felt more comfortable, more confident. And so this researcher got interested in the idea and said, okay, well, let's be a little bit more precise. So they placed EEG on a couple of patients who carry the diagnosis of PTSD and were already planned to receive anesthesia. Following the surgery, they maintained this pre-emergent state for 15 additional minutes with propofol. Now, again, they noted beta and some high frequency frontal power, which, if we're arguing towards this frontal temporal activity, is maybe consistent with lucid dreaming. A lot of these patients who they studied reported vivid but also very positive dreams, often with lucidity. And interestingly, they asked these patients to answer some questions from the CAPS-5, which assesses PTSD, and the PHQ-8 for depression. And you could see at four weeks before surgery, they were at much higher levels than 4 weeks after surgery, and this seemed to sustain for almost a year afterwards. So they concluded that there was this sustained improvement in both PTSD and depression scoring just from this additional propofol-induced dream period that happened during their surgery. So I want to offer some concluding thoughts. It's exciting to know that lucid dreams are experienced at least once by a lot of people. We know that PSG with expanded EEG may help distinguish lucid dreaming from REM sleep. There are potential benefits to lucid dreaming. The one in particular that stands out if you want to teach yourself or teach others is the mnemonic induction of lucid dreaming technique, which can increase lucid dreaming, but does carry the risk of potentially fragmenting sleep. And particularly as tech companies are becoming more and more interested in the future of our world, I truly believe that dream engineering and that kind of technology will likely continue to expand. So thanks so much for coming, everyone. I'm happy to answer any questions that you may have. Thanks so much.
Thanks, Ian. That was a really great talk, sort of definitely out of the out of the norm for us sleep folks, and still obviously a lot of science that needs to be in the area. If you have any questions, please go ahead and put it on the chat. Let me see. Oh yeah, sorry. And if anyone wants to just raise their hands, you can do that too. All right, so we do have a question. Tamana has asked just the general audience here, has anyone been able to lucid dream? I can give you my answer. Just last week, and I don't know, it's because I was thinking about Ian's lecture or not, but I did have a lucid dream. Interestingly, I was on a plane on the wing and holding on to the door, being blown off. And then I shook myself. I said, this is not real. And I decided I didn't want to be there. So I rewrote the script and I made myself fly backwards, get in a seat, and then I took off again in the airplane. And I remember when I woke up, I said, wow, I think I made that happen.
That's awesome. Yeah, I've been working to try. I've been trying the mild technique, and I think successfully had one lucid dream. Although it does fragment my sleep for sure.
Laura, did you have a response or question?
Yeah, I was trying to unmute. That was really fascinating. Yeah, thank you so much for that talk. And two quick points. One is, it seems that given the high prevalence of lucid dreaming among patients with narcolepsy, that sort of argues for the fact that it's maybe this hybrid state between wake and dream. So I was hoping you can comment. And then I had one other comment to make.
No, I agree with you. I think it's I agree that it probably is a hybrid state, and the question becomes, what do we do with that, right? Is the hybrid state, and we should consider it as a fragmented piece of sleep? I mean, is it something we need to worry about if people are lucid dreaming a lot, or is it something that this is a hybrid state, it's unique, and we can just let people enjoy it?
That is fascinating. I'll see if I can put this paper in the chat. I think I sent it out to our group earlier this or last year. Was a paper in PNAS, in fact, about, and it sort of is along the same line of sort of sleep engineering, but they were able to pretty convincingly find a way to weaken aversive memories in human sleep by training people to cue memories with certain words, and then during wakefulness, and then also associate positive memories with certain words. And then they played those auditory words during sleep, and it actually weakened the aversive memory. So I think there is something to this sort of engineering of sleep to help with, perhaps emotional states, but I think we're just at the very beginning of even thinking about this. I'll put the paper in the chat.
Did you
Yeah,
want to
I think it's a really interesting topic. I know that EMDR therapy sort of operates in a similar space where you are meant to re-enter a memory and then reframe it. And so I think, and you do that in sort of a meditative state, but being able to utilize sleep as well, I think is really, really interesting.
And I think in a sort of similar theme here, Richard Zhang put forth the question, did you come across the effectiveness of lucid dreaming versus imagery rehearsal therapy for patients with PTSD and nightmares? They seem to have sort of a similar idea of therapeutic modality.
Yeah, I think it's a good question. I didn't see anything directly comparing the two, but I think it's a really good point that they are certainly very similar in the way that you're trying to sort of take control and yeah, again, rehearse that space, but instead of reliving it, being able to change the outcome or change your reaction to that event. So I think coming at it from multiple areas, as I think Clara described, I think is really the key. And maybe using lucid dreaming or using some of the techniques described in the PNAS paper, I think are really interesting.
It'd be sort of like exposure therapy for phobias too, right?
Mm-hmm.
Um, sort of on that line. So what do you think is the we don't lucid dream, but we all do dream. So what do you think is the or what are the hypotheses out there about the purpose of dreaming? Why do we dream anyway, whether we control it or not?
Yeah, I mean, I think a lot of, dreams are sort of meant to help with emotional processing, with consolidation of memory, with new synaptic connections and pruning that we're hoping for, in this sort of like we're thinking about the glial hypothesis and all of that important pruning that happens in the brain, that maybe dreams are a manifestation of those things. Hard to say in
You
that state.
being just with the functionality of what dreams are supposed to be happening for us regularly, that controlling it um, would impact the function of dreams or not necessarily.
Well, I think it depends on like what you're doing with the dreams. I think Dr. Hoffman just put in that, when he starts lucid dreaming, it's hard to stay in that state. And so in that case, the lucid dreaming is maybe causing you to wake up more. And for other people, they can stay in that space and they can build creativity, or, do some exploring, or, get back in a plane. But I think it's probably person to person specific. And I think I would caution people that are aggressively trying to lucid dream if they already have some underlying diagnosis of something like insomnia, in which case it might make it harder to have consistent sleep.
That Stanford paper that you mentioned with propofol, are they looking that as a drug for lucid dreaming, or how are they thinking to use that?
They're not specifically saying that it's for lucid dreaming. They more just wanted to sort of have this prolonged, anesthesia dream state, is kind of, I think, how they were describing it. They weren't specifically saying it's lucid dreaming, but they're noticing that maybe some of this frontotemporal activity is consistent across multiple studies that are looking at lucid dreaming.
I knew I liked propofol for a reason.
We just ask all of our dice patients how they're doing.
There you go.
Hey, that's a good population. Yeah. Yeah. So if anybody has any research ideas about, you can collaborate with our ENTs who are doing DICEs. Presumably, presumably they're on their propofol, right?
I think so. I
Yeah.
assume they stay away from benzos. I don't know what they use for, is that what they use for sedation, guys? For those of you
Yep.
who chatted them? Yeah.
Ooh, so Donna, it sounds like Donna does her own lucid dreaming. Let me see. So Daniel McNally says REM sleep also plays a developmental role. The more immature a species is at birth in terms of brain development, the greater the REM sleep percentage. Yeah, so again, to Ian, your point that REM sleep is important in synaptic formations and brain development. I guess when you lucid dream, you can maybe somehow influence how your brain develops. Maybe that's a hypothesis. Anyone else have any questions or comments? Okay.
Thank you, Ian. That was a great talk.
Yeah, I appreciate everyone coming by. Hope it was interesting, and you can certainly read more about lucid dreaming to try to do it yourself.
Hey, Ian, I have a question. Are you looking to devise some kind of technology or device for lucid dreaming?
I'm always interested in tech. Yeah, I mean, especially with like working with Dr. Miner, and she's using the EEG headband already in an outpatient setting. The question is, can we induce lucid dreaming via stimulation of EEG? So far, at least the studies looking at that have not been very promising, but it's definitely something that interests me.
Would be the next virtual reality thing we have.
Yeah.
All right. Well, thank you guys. So we'll end this great talk with a lot of thinking.